Hi, my name is Aislinn Yuen. I will perform the skill testing on adding the medication to the piggyback. So first of all, I have to gather all my supplies. So I have all my supplies here. And I will check for the medical histories and histories of the allergy comparing to prescription. And I will check for the patient mark comparing to the prescriptions I have here. And I will check, so Mr. Tutu, who was born January 1st, 1937, is getting the medication called diamond hydrated. The dose is 50 milligram, route is IV, and it will start on February 12, 2018 at 11 a.m. So I will actually do my first checks right now. I will check for the name of the medication and dose comparing to the MAR. I have the medications here, diamond hydrated, 50 milligrams. So the dose is diamond hydrated, 50 milligrams. So after I do my first check, I will check to see if the expiry date of the medication and the expiry date of the piggyback, and to see if the piggyback actually compatible with the primary line. And after I check all that, I will assess for the patient IV site to see if any infiltration, any redness, any abnormalities. And after I check for that, I will go ahead and do my calculation. And so I will calculate for how much medication I will withdraw from the viral and add into the piggyback. So I will withdraw 1 ml of the medication, diamond hydrated, and add into the piggyback. And at the same time, I will actually calculate their drift rate for their secondary for their medication. So I have here is the secondary medication sets at 10 drops. So the drift rate going to be 17 drifts per minute. So after I did all my calculations, I will perform hand hygiene. After I perform my hand hygiene, I will do my second check. So I will check for the name of the medication and the dose comparing to the MAR. So I have diamond hydrated here, and Mr. Tutu is getting diamond hydrated 50 milligram. So after I do my second check, I would actually go ahead and prepare the label. So after I preparing the label, I will go ahead and withdraw the medication from the viral and add it into the piggyback. I will clean the viral. I will actually make sure there's no bubble. So I have here is 1 ml. And then I will add this into the piggyback. I will clean that. dispose this needle into the sharp container, and I will gently aspirate the piggyback. And then I will add the label on the piggyback. So I would have to make sure that I don't add the label on the wordings part. So I will add the label on the back of it. So after I add the label on the medication, so I have the medication here, is I will going to do my third check. So I will check for the name of the medication and a dose comparing to the MAR. So I have the medication here with me, a diamond hydrated. Mr. Tutu is getting diamond hydrated, 15 milligram, and to the piggyback. So after I compare my third check, I will bring the medication and the MAR going to the patient bedside. And at the patient bedside, I will introduce myself. So, hi, Mr. Tutus. My name is Aisen Nguyen. I'm a nursing student at the collaborative program with George Brown and Ryerson University. And I will give you the medication called diamond hydrated, 15 milligram, to the piggyback, and it's connected to your primary line. So, and then I will actually do my, I will ask Mr. Tutu for his name. Can you tell me your name? And Mr. Tutu will say his name is Mr. Tutu. And can you tell me your date of birth? His date of birth is January 1st, 1937. And I would actually verify his hospital armbands as well to compare it with the MAR. And I'll go ahead and do my fourth check. So I will, after I verify this is the right patient, I will do my fourth check. So I checked the name of the medication and the dose comparing to the MAR. So I have the medications here, diamond hydrated, 15 milligram comparing to the MAR. Mr. Tutu is getting 15 milligram, diamond hydrated. So after I do my fourth check, I will ask Mr. Tutu if he have any allergies, and he have any allergy with the medication, or he have any type of allergy. So Mr. Tutu, do you have any allergies? So he will say no. And I will check for his hospital armband to see if he have any allergy armbands on him. And after I check for the allergy, I will go ahead and add my medication, my piggyback, into the secondary line. I'll perform hand hygiene again. I have to make sure that I close all the roller clamp, and I will hang the medications up. Open that and spike it into the piggyback. Fill medications halfway into the chamber, and then I will now go ahead and prime my secondary bag line. So I already primed my secondary line, and clean up all of this. So after I prime my secondary line, it's now I'm gonna hygiene one more time. And then I will clean the pot closer to the primary line. And connect the secondary to the primary. After I connect their secondary to the primary, I'm going to lower the primary bag and then hang the secondary bags higher. And then I will fully open the clamp for the secondary bag. And after I fully open the clamp for the secondary bag, I will actually adjust the rate for the primary line, which is going to be 7 drip per minute. So after I adjust the primary line at 7 drip per minute, I'm going to document what I do today. So I will actually document that Mr. Tutu, who was born January 1st, 1937, is getting the medication called Demin Hydrated, 15 milligram to route to the IV over their 30 minutes of time at 11 o'clock. On February 12, 2018. So after I do my document, I will actually see if the patient have any reaction to the medication it's giving to him. And that's it. Thank you for watching.